Welcome back, everybody, to the Internal Compass podcast, the podcast where I, your host, Samuel Archambault, is trying the best that I can to help you figure out how to get more aligned from inside out. All right. Today, we have a very interesting topic. This week, I want to talk about fascia. What is fascia? What's its role? How can we influence it? And especially, what's the role between fascia and how do we manage our pain? Because this is the entire topic of this podcast. So I want to really make the connection between fascia and pain. Fascia has become very a trendy topic in the last couple of years. And that's mostly because there has been a lot of studies around fascia. And hopefully that's a great thing because the more we're learning, the more we can apply tools around fascia to use it at our own advantage in a way. So today what I want to do is not only deconstruct what fascia is, I also want to educate you a little bit more on like where does it come from and what is exactly the role of fascia. Because we all heard like if you went to a yoga class, you are going to work on your fascia. I will explain what exactly does that mean in more concrete terms. Because fascia for some of us will remain this kind of obscure matter that we don't really know what it is, but actually fascia is a well-defined structure. And actually, the more we learn about it, the more we understand that its role is like super important for our overall health, but especially in the context of pain management. So, hey, that's what I want to attack today. So let's get started. First of all, what is fascia? Fascia, in a very broad and simplistic term, is irregular waves of collagenous fibers. So, in English, what does that mean? Is that fascia is mainly created or composed of collagen fiber. Collagen fiber is those kind of fibers that are very hard to tract and hard to extend and is not very flexible. So your fascia is not necessarily like a band. Your muscles are like a band. They can get stretched and in like one way or another. But fascia doesn't really work like that. Fascia, those collagen fiber, they are more a kind of web that will shape itself depending on the form. So as a whole, the fascia, yes, will be able to adapt, but is not necessarily flexible. Think about it as a spider web. If you pull on one end of the spider web, it's not necessarily that each web is getting extended or flexed. It's more that the shape of the web is going to move entirely to kind of adapt to your traction or wherever like there is some tension on that specific web. Your fascia is actually not made to resist 90-degree pressure. What I mean by that is that if you take, for example, a muscle or a ligament, so basically what connects two bones together to ensure stability, and you move that ligament from 90 degrees, so let's say left to right, this is made for that. Ligaments are actually made for that because they are there to ensure stability in all different shapes or form, especially in all directions, right? So if you look example as the ligaments around the ankle, well, it's made that doesn't matter where the ankle is going to go. There is going to be some stability in there. That's where the ligaments are there. But fascia is not really made for that. Fascia is more to adapt into a traction and contraction way. And it's not really made to go left and right like in a shear position, but more of a pull and push and adapt the situation. Fascia is, yes, I've said it, it's collagen fibers, but where is it exactly? Well, fascia is nowhere and everywhere at the same time. Fascia is around everything in your body. Another word actually for fascia is connective tissue. Maybe you've heard that in the past, but basically, if you would open your body right now and you would look at your heart, your lungs, your muscles, well, guess what? It's not like exactly in the anatomy book. All of that, all of your viscera, so all of your organs, all of your muscles, all of your bones, they are all connected by this fascia, by this connective tissue. So those collagens are kind of a very deep web that not only connects everything together, but also we've learned that it's actually holding everything together. So if you look at the principle of tensegrity, now you might ask, hey, what is that? Tensegrity is this concept where, exactly like I talked about this spider web, if you have a system that all kind of work together, so my body, as I'm standing right now, I'm able to stand straight because of the contraction of my muscle. But if I lean back or if I crunch, this pressure that is going to be applied on my body on one side or another is actually going to be adapted, compensated by other structures so that the whole, so my entire body, can move in space and respond to things. So, example, if someone pushes me on the side, well, I will have to adapt. So my entire body is going to have to absorb this shock. And for that, that's where actually collagen fibers and fascia comes at play. So not only collagen fiber are there to connect things and to hold them together, but they're also there to help pressure and to absorb the shock. So now maybe you know a little bit more about, okay, what is fascia? It's collagen fibers, great. It holds everything together, it connects everything together, great. And at the same time, it holds everything together because it's kind of this system where not only it gets pulled by each structure. So example, if my fascia connects my bones together, it's not the fact that I have one bone on one side and one bone on the other side that is pulling, but also there is this kind of a interpressure. So there is pressure from inside pushing outside. And that's, you can see that example in the abdomen. So when you breathe, you have this breathing pressure that comes from your belly, from your diaphragm, that kind of it pushes everything towards the outside. So you can see that tension is not that only you're getting pulled from every corner of your body, but also you are getting kind of pushed from the inside, if that makes any sense. So fascia is amazing because not only there are collagen fibers, but they're much more than that. They're also fibroblasts. So fibroblasts are a type of cells that creates collagen. Okay, so far so good. And if you're already right now, you're a bit confused and you are wondering why you need to learn all of those things, I reassure you right now, you don't. You don't have to learn out of all of those things. But I think that better understanding what are we talking about will allow you later on in the episode to maybe better understand the role of fascia in pain. So stick with me. So we said fibroblast, which creates the collagen fibers, right? Those kind of a web section of our fascia. Then you have obviously collagen. You have those elastic fibers. So that, remember, collagen is not flexible, but you do have a little bit of elastic fibers in there to make sure that it can adapt its shape and form to the pressure around, right? And guess what? You also have in there a lot of receptors, or in other words, a lot of receptors. You have receptors for chemical signals, you have receptors for electrical signals, so in other words, neurons. You have nociceptors, receptors for pain. You have thermoceptors, receptors for changing or changes in temperature. So you see, and hopefully now you start to understand that fascia is not only this kind of web that helps the structure stays in place, help us to stand nice and straight. No, no, no. It's much more than that. It contains a whole bunch of receptors that helps to regulate your body in many different ways because it will affect how you perceive temperature, pressure, pain, nociceptors. Of course, it's in there. Think about that. All of those collagen fibers are also around all of your vascular system, your arteries, your veins. So you can tell that if there is a dysfunction in the fascia, if the fascia cannot glide and adapt properly to the forces around, well, guess what happens to the liquid and the vascularization of your body? So if you want to put that into a concrete example, people who have edema somewhere, well, you can probably tell that at that area, the fascia doesn't allow for proper irrigation, for proper liquid to go back and forth in that area. Because if it would, there would not be such edema, so such accumulation of liquid. Okay, the last thing you have in fascia is also a new type of cells called fascioblasts. And that's a fancy term just to mean those new cells that actually creates this kind of a liquidy, gluey liquid that helps the fascia to slide between each other, because yes, those collagen fibers, they're a little bit into like every direction because they need to be compensating for many different forces from 360, right? So in other words, you need all of those collagen fibers to be able to slide properly. So now, if you think about that, you might think, oh, okay, liquid. Well, you might see that for fascia health, it's going to be very important to stay hydrated. And that's one thing we will expand a little bit later on. So stay tuned. Okay, one more thing I want to say is that actually one really interesting thing about fascia is that we might think that, we have collagen, we have this fascia, and then it just stays like that. But actually, they've been doing latest research on the fascia, especially in women, and they have understood that about every 2 weeks, the entire fascia rewrite itself. Okay, it's nothing new. Our body creates new cells, which replaces the old cell. All of our cells in our body, our trillions of cells, they have a mechanism that will tell the cell, hey, now it's time to die and it's time to decompose so that new cells can take over. It's the same thing for fascia. So think about that. Every you're around, okay, it's not a science number, but it's not an exact number, but about every 2 weeks, your entire body, how it is structured, will renew itself. That's a great thing because that also means that you can have a lot of influence over it. So if you have a new practice, well, it doesn't take that long until your fascia is going to be able to feel and to sense and to change itself to accommodate the new activities that you kind of impose on him. So if you are very sedentary, you don't move at all, and then out of a sudden you start to move, you start to mobilize your fascia. Well, you can tell that within a few weeks, for sure, you are going to see some major changes in how you feel, your posture, how you breathe, because your fascia will be able to adapt to your new activities. And that's important to know. The body is a big machine of adaptation. Whatever you will impose on him, it will adapt to it. So if you have a healthy lifestyle, it will adapt to this. If you have an unhealthy lifestyle or a sedentary lifestyle where you don't move at all, it will also adapt to that to make it as efficient as possible to your lifestyle, to your physical activity level, and so on. Okay, now you might think, okay, now we're at a point where we've had explained what fascia is. We explain its role in having all of those different receptors, right? Well, what I want to go into now is what can be different problems? In other words, what can be different problems around fascia that you might feel? And especially towards the connection between fascia and pain management. Well, of course, we're going to start to see problem if someone has a sedentary lifestyle. And why? Well, it is pretty simple. Remember, fascia goes around everything within your body, and it is made to have pressure on it and to kind of be imposed some kind of a stimuli. So if you don't move at all, well, your fascia is made to glide, it's made to move, it's made to adapt to different forces. So if you don't use that capacity, well, guess what? It's going to lose it. There is a concept or kind of a process that right now is being studied, and we are just at the beginning of that, which is called mechanotransduction. And mechanotransduction is the concept where when you apply pressure to a system, and especially now we're talking about cells, so collagen, fibroblast, what fascia is being composed of, if you apply pressure to this, it's going to change not only its shape, but actually the fact that it will change its shape will change the expression of genes of that cell. Okay, I'm going to repeat that in maybe a more simple way so you can understand how this is like a revolution in science. In other words, if I have pressure on my body. So now you can think about, my profession in osteopathy. We use this system quite a lot in massage, in physiotherapy, in chiropractic. And not only that, but also exercise, right? If you will lift heavy weight, if you're going to run, if you're going to move your body in a way that you apply some pressure, you jump, you throw, you kick, whatever you do, but that pressure that you apply on your muscles, on your cells, on your entire system, is going to trigger some receptors that are actually going to change your genetic expression, meaning that it's not your gene that changes, but it will activate few genes that will respond to that pressure. And that's super important because it will have a major impact on your fascia. In other words, yes, of course, if you don't move, if you have a sedentary lifestyle, now you can understand that, of course, it will start to create some problem in fascia. And guess what? All of what creates problems right now that I'm describing that will impact fascia, if you do the opposite, well, that's how you take care of your fascia, of your connective tissue. Next one is limited range of motion and poor posture. I don't want to get too deep into posture, but what I would consider poor posture is a not very a posture that doesn't really allow you to be within an advantage, or in other words, which is not biomechanically an advantage. Every posture is okay. There's no bad posture. It's just that if you are stuck in a specific posture, that's where it gets a little bit more complicated. So of course, if I'm crunched forward with my shoulder forward, this is not bad if I'm able to come back straight and up. And same thing, if I'm straight and up, it's not good or bad. But if I can't move from there, if I'm stuck in some position, that's where we start to have problem, especially with fascia. Because remember, fascia is adaptive and connective tissue. If you are always in one position, it will adapt to shape itself around that one position. If you are able to move in between different postures, that's ideal, because then it will never adapt to one of them, but it will better be adaptable to all of them at the same time. And of course, if you have limited range of motion, you don't stretch, there is nothing you can do to move your body into different type of motion. You have difficulty to lift your hands above your head. Your hips are really restricted. That will also affect fascia, because remember, fascia is around muscles and they kind of connect everything. So the difference between flexibility of a muscle and mobility of the fascia is almost impossible to distinguish, because basically they are kind of the same. They are all connected. They are all one big tissue. Under a microscope level, you could see the muscle and the fascia starting, but if you pull on one, you pull on everything, right? All of those things are connected to each other. If you do any type of repetitive movement, yes, this can have an effect on fascia negatively, because of course, again, fascia will adapt. So if you do only one type of movement, it will adapt to this movement, and that's not necessarily bad, but it's in a way that if now you try to do some other movement that is your body is not, or your fascia is not adapted to that specific movement, that's where it gets a little bit more complicated and that pain can occur. A last one is regarding surgeries and injuries. So of course, if you've had surgery, you had a scar, or if you had some type of an injury that maybe has impacted your true fascia, then yes, this could actually have a negative impact on your fascia, negative in a way that it will maybe limit its expression, how you're able to move in space. And that can create what we call adherences, which are basically that we can treat in osteopathy, but are basically when you have two layers of fascia that are kind of a bit stuck together. There's no liquid that go in between, and there's no gliding in between. That especially occurs in surgeries where now you have this healing process that kind of stick everything together. It's much stronger tissue, but it's not as tractable, movable like fascia is. Okay, so what do we do with that, right? If you've been listening to me so far and thinking, oh crap, yeah, I kind of have all that, or I'm experiencing all that, so what do I do with this? Well, hopefully for you, don't worry, there's always a way to work on healing your fascia. First thing you can do, be more active. That's probably the number one thing you can do to have a healthy fascia. Move in any way possible. Running, walking, lifting weights, yoga, anything will help. Okay. I actually prefer, or actually like, if you would do some specific mobility training, because then at that during those specific type of training, you'll be able to work in limited range of motion and try to gain range of motion, which will definitely have an impact on fascia. Remember, more pressure, more traction on fascia, better the response. So of course, working on mobility training, any type of lifting weights, also very good, because then you'll have a a good pressure, a good force applying, and that your fascia will have to answer to that. And of course, any physical activity that will raise your heart rate up, because heart rate more up means more vascular activity, meaning more blood to the extremities and everywhere in your body, more circulation, and therefore more movement between the fascia. Remember, within your fascia, all of your veins and arteries goes there. So the more you have movement of fluids in between those fascia, the better quality they will be. Remember, those different fascia layer need liquid to be able to move between each other. So more activity, better your fascia will hold itself up. Any type of massage, osteopathy, physiotherapy, where you'll have pressure, mobilization, this is all very good. It's not curing everything though. Don't expect that in 1 hour massage or osteopathy treatment, you're going to change your fascia like crazy. No, I see this more as a supportive element. It's more in your day-to-day what to do, what you will do that will help in the long run. This is kind of a little booster, especially if you think about it this way. It's going to create a window of opportunity where, example, you have massage, you can relax your muscle. Then, of course, not only it relaxes your muscle, but it relaxes your nervous system. And from there, you're able to build better habits, have more range of motion, and so on to work within that window of opportunity. So all of those strategies can be combined, right? There's not one that is better than the other. Use all of them if you can. That's a simple trick, but maybe don't do repetitive movement. If you can, some people will have work, sports, or some other. I think about like guitar player. They will always do some specific movement. If you are a thrower at baseball, guess what? You're going to throw always with the same arm. That's life. But in other words, if you're able to limit that or then work actively to train the other side and make sure you keep proper range of motion, great. Your fascia will also thank you at that point. We haven't talked about sleep and recovery, but those are also very important things. One detail, actually, pretty important detail that I haven't really expanded on so far is that of all of those different receptors, remember, that is part of your fascia, there's also a part of your immune system that lays in your fascia. And yes, that plays a huge role. Macrophages, those are the type of cells that, they look like small Pac-Man that kind of eats other bad cells, in parentheses, to kind of macrophage, to kind of, the word come from eating, so to eat those other cells, that is part of your immune system. So of course, if you are able to support your immune system by sleeping better, probably the best way to support your immune system is by having quality and good quantity sleep. And then proper recovery, meaning you're not stressed all the time, you can manage it, and you're able to down regulate yourself. Well, definitely, if you're able to do that, your fascia is going to thank you. Two more what you can do to help your fascia. So you can definitely hydrate more. Hydrate not only water, but also, if necessary, depending on your level of activity, something with electrolytes that will help better water movement between where actually need to go to the proper cell. So plenty of water during the day. That's a no-brainer. I really recommend it for a whole bunch of different reasons, but clearly it will have one for your fascia. And the last one is heat. So of course, maybe some of those strategies are not always useful for you, but you can apply some heat, like sauna, or like a warm patch you can put on some specific area that might feel a little bit more tight. Then during that case, yes, this will also help to relax. To put that into context right now for the pain management side of it, think about it this way. If your fascia is everywhere in your body and it contains those nociceptors that you are actually feeling pain, that means that the more restricted your fascia, the more it will trigger those nociceptors, meaning the more pain you are going to have. And actually, there is a literature review that I will actually put in the show notes, which is called Fascia Innervation, a systematic review of the literature, has shown that fascia who is dysfunctional, meaning fascia that cannot glide as properly as like a normal one. So if you have a restricted fascia, there is actually more there is more concentration of nociceptors. So I will repeat that in English. That means that if your fascia is not healthy, can't move properly, cannot glide, it's not functional, that means that in that area, there is going to be more sensors for pain. So that means that the same stimuli will raise your pain level. So if someone who has a healthy fascia compare to someone who has a restricted fascia, the same event, the same hit, the same disease, the same scar, whatever, the same situation is going to have a different effect on pain receptors. So basically the one with the restricted fascia is going to perceive more pain or receive more pain to the brain compared to the one who has a healthy fascia. So all of those are extremely important reasons to just take care of your fascia, because taking care of your fascia is taking care of your life, in other words. So I hope this has been useful and insightful, and I hope I have convinced you that fascia is the future when it comes to taking care of your body. So remember that fascia is a connective tissue, basically, that connects everything in your body. It's this type of web that will adapt to your environment and hold all of the pieces inside of your body kind of together. But fascia is much more than that. Fascia holds a lot of different receptors, especially pain receptors. And that if you take care of your fascia by moving more, by doing some mobility training, massage, self-massage, with a ball to apply heat, don't do too much repetitive movement, sleep and recover well. I know that's a long list. Then you will be able to take care of your fascia and make sure that it glides properly. It's quite reactive and adaptive. Then overall, I believe that you will live a better life and a more pain-free life. I hope this has been useful, and I will see you in 2 weeks for another episode of the Internal Compass podcast.